Welcome to part 2 of the ED Innovation Study training video. This section is to teach you how the medication buprenorphine, the active ingredient in Suboxone, works for opiate drug addiction, and how this pertains to the study medication in question. The study is really focused on the effectiveness of a new subcutaneous extended-release buprenorphine medication called CAM2038. Buprenorphine is an opiate medication that was created to have less euphoria effects and therefore less addictive and abuse potential, and yet is able to provide relief for the craving and withdrawal symptoms of opiates. In other words, it's able to help people with opiate addiction to stop abusing opiate drugs, including heroin, fentanyl, morphine, as well as prescription opiate medications such as oxycodone and hydrocodone. You have probably heard of the medication Suboxone, which uses buprenorphine as its active ingredient. Opiate medications work by binding to the opioid receptors in the brain and other nerves in the body. The effects of these activated opioid receptors range from euphoria, pain relief, respiratory depression, sedation, and slow GI motility. Almost all opiate medications that cause addiction are full opiate agonists, meaning that they fully activate the opioid receptors in the brain, resulting in maximal opioid effects. Neurons using these opioid receptors may decrease the numbers of these receptors, resulting in the need for more full opioid agonists in the bloodstream. And if there isn't enough, withdrawal symptoms will occur. Opiate withdrawal symptoms are the exact opposite of the symptoms you would see in the activation of these receptors. These withdrawal symptoms include agitation, restlessness, muscle aches, vomiting, and yawning. Buprenorphine is what we call a partial opioid agonist. It will bind an opioid receptor very tightly, but it will only activate it to a lesser degree than full agonists. This results in less euphoria, respiratory depression, and sedation than full agonists like heroin. In fact, buprenorphine has a much higher attraction to the opioid receptor than most drugs. It may even kick off other full agonists off of the opioid receptors in the process of binding to them. This is why buprenorphine can cause withdrawal in patients recently on opiate drugs. This is called precipitated withdrawal. Patients will need to be off of opiate drugs and in a bit of withdrawal before taking buprenorphine. Buprenorphine's very strong opioid receptor binding effect over other drugs also provides a relative protection of the user from an overdose. Now that you know how buprenorphine works, it's easy to see why it's so effective in the fight against opiate addiction and abuse. Without the craving and withdrawal from opiate drug use, a treated patient may resume a normal life, focus on a job or a family. For the purpose of our study, we know that placing a patient with opiate use disorder on buprenorphine or Suboxone upon discharge from the hospital significantly increases the chances of making it to an outpatient behavioral specialist who will eventually be able to treat the disorder long-term and continue to prescribe this life-saving medication. Traditionally, upon discharge, these patients are given a prescription of Suboxone to help prevent relapse and overdose, with instructions to take the medication daily until their scheduled appointment with their behavioral specialist. However, this process is not without its issues. For example, the ER provider may not be waived to prescribe Suboxone, or the patient may not have money to pay for the prescription. He or she may misplace the prescription or misuse the medication, which increases the chance of the medication being diverted. Some may have withdrawal or cravings in between doses. The medication in study here is CAM2038, an injectable buprenorphine that is injected subcutaneously and has a depot effect, releasing the medication into the bloodstream at a uniform amount over time. One dose of this medication before ER discharge may eliminate the mentioned issues with the traditional Suboxone prescription. Starting Suboxone in the emergency room has helped thousands around the country. And even better news is that we may be able to do better. Part 3 of the Innovation Study videos goes into how our study protocol will run and work. Again, if you have any questions, please talk to our primary investigator, Dr. Williamson, or the co-investigator, Dr. Lee. Thank you for everything you do and allowing us to be part of the heroic moments of your lives.